acinic cell carcinoma is found in salivary glands. What is true about parotid tumor? Facial nerve involvement indicates malignancy. Pleomorphic adenoma is most common variety. Superficial parotidectomy is the treatment of choice. ENT glomus tumor arises from mesoderm. Commonest manifestation of CA nasopharynx is secondaries in the neck. Nasopharyngeal carcinoma originates in fossa of Rosenmuller. The Suck-Hoyer canal is related to glomus tumor. Which among the following is a feature of fracture of zygoma, diplopia? Predisposition for carcinoma ethmoid sinuses by wood dust. What is the narrowest part of the respiratory tract in children? Subglottic area. Which one of the following is the primary defect in Pierre-Robin syndrome? Micrognathia. Dentigerous cyst arise from an unerupted permanent tooth. Neck structures preserved in functional radical dissection of the neck, internal jugular vein, sternomastoid, and accessory nerve. Earliest tumor to appear after birth is cystic hygroma. Most common site for thyroglossal cyst is subhyoid. Cystic compressible translucent swelling in the posterior triangle of the neck is cystic hygroma. Treatment of cystic hygroma is surgical excision. Cyst trunks operation is used in thyroglossal fistula and thyroglossal cyst. Addison's test is positive in cervical rib. Radical neck dissection involves removal of all except omohyoid and tail of parotid. So radical neck dissection involves internal jugular vein and submandibular gland. Which of the following does not move on deglutition? Sublingual dermoid does not move on deglutition. The brilliantly transilluminant tumor in the neck may be cystic hygroma. Thyroglossal fistula develops due to incomplete removal of thyroglossal cyst. Which of the following is not excised in radical neck dissection? External carotid artery is not excised. Internal jugular vein, spinal accessory nerve, and sternocleidomastoid is excised. Secondaries in the neck with no obvious primary malignancy is most often due to carcinoma of nasopharynx. Radical dissection of neck includes all except phrenic nerve. So radical dissection of neck includes cervical lymph node, sternocleidomastoid, and internal jugular vein. Regarding cervical rib, which statement is correct? It causes pressure on the ulnar nerve and pain is often located in the forearm. Which is never a cause of thyroglossal fistula? Congenital is never a cause of thyroglossal fistula. Infection of thyroglossal cyst, inadequate removal of thyroglossal cyst can be a cause of thyroglossal fistula. The most common site of the internal opening of tonsillar fossa. The most common site of the internal opening of a branchial fistula is at the tonsillar fossa. Which neck swelling moves on swallowing thyroid gland? All are true about cystic hygroma except pulsatile. It is not pulsatile. So which are the features? It may cause respiratory obstruction, common in neck and present at birth. In modified radical neck dissection, structure not preserved is submandibular gland. So which are preserved? Sternocleidomastoid, internal jugular vein, and accessory nerve. Hyoid bone is closely associated to thyroglossal cyst. Which of the following swelling moves as protrusion of tongue? Thyroglossal cyst. Cystic hygroma, excision of cyst at an early age. Commonest site of branchial cyst, upper one-third of sternomastoid on anterior border. A 75-year-old woman underwent neck exploration for hyperthyroidism 5 years ago and parathyroid adenoma was excised. At present, she is recovering from a myocardial infarction 6 weeks ago and she is in mild congestive heart failure. Her electrocardiogram shows a slow atrial fibrillation. Measurement of her serum calcium shows a level of 13.0 milligram per deciliter and urine calcium is 300 milligram per 24 hours. Studies suggest a small mass in the paratracheal position behind the right clavicle. Appropriate management at this time is ultrasound guided alcohol injection in the mass. Precancerous lesion of the larynx include keratosis, laryngitis, and pachyderma laryngis. Trotter's triad is seen in nasopharyngeal carcinoma. All are true about cystic hygroma except aspiration as diagnostic is false. What is true is it 50% present at birth, presents as posterior cervical swelling and sequestration of lymphatic tissue. True about cystic hygroma, congenital sequestration of lymphatic surgery is the treatment of choice. In the management of thyroglossal cyst, central portion of hyoid is excised. What is true about carotid body tumor? Non-chromaffin paraganglioma, good prognosis and rarely metastasizes. Thoracic outlet syndrome is characterized by wide variation of symptoms and cold exposure and exercise can precipitate. What is true about carotid body tumor? Commonly seen in high altitude habitats and 10% have family history. Excision of hyoid bone is commonly done as in thyroglossal cyst. Commonest treatment of branchial cyst is excision. In which one of the following perineural invasion in head and neck cancer is most commonly seen? Adenoid cystic carcinoma. Which of the following best represents ranula? Cystic swelling in the floor of mouth. Which of the following statement best represents Ludwig's angina? An infection of the cellular tissues around the submandibular salivary gland. True about branchial cyst is mostly arises from second branchial system. True about branchial cyst, wall consists of lymphoid tissue filled with straw colored fluid with cholesterol crystals. Structures not removed in radical dissection are vagus nerve, tail of parotid and post-auricular nerve. Which one of the following is the most common tumor to produce metastasis to cervical lymph node? Nasopharyngeal carcinoma. Which vital structure is preserved during radical dissection? Vagus nerve. Which of the following is used to define penetrating neck injury? Breach of platysma. In which of the following head and neck cancer is lymph node metastasis least common? Hard palate. Which is incorrect about cystic hygroma? Radiotherapy. What is correct? Brilliantly translucent, sclerotherapy with bleomycin and sclerotherapy with actinomycin. In posterior radical neck dissection shoulder syndrome, all are seen except normal electromyographic finding is not seen. What is true is restricted range of movement, pain and shoulder drooping. What is true about branchial anomaly? It is most commonly due to second branchial remnant. What is true about branchial anomaly? It is most commonly due to second branchial remnant. About congenital torticollis, all are true except always associated with breech extraction. So, what is true about congenital torticollis? Spontaneous resolution in most cases. Two-thirds cases have palpable neck mass at birth, and uncorrected cases develop phagocephaly. Brilliant transluminant swelling are all except lipoma. So, which swelling are brilliantly transilluminant? Hydrocele, meningocele, and meningiocele and cystic hygroma. Consider the following statement about branchial cyst and which are correct. So, they are associated with tract passing between the carotid bifurcation, usually present in early adulthood and occur along the lower one-third of the anteromedial border of the sternocleidomastoid muscle. The subclavian steal syndrome occurs due to occlusion of the subclavian artery proximal to origin of vertebral artery. Following block dissection of the neck, a person is unable to move his head upward and to sideways. Which of the following nerve is injured? Spinal accessory nerve is injured. Thyroid gland, therapy of choice for diffuse toxic goiter in a patient over 45 years is radioiodine. Symptom of endemic goiter are all except none. What so symptoms of endemic goiter are cold intolerance, hoarseness, dysphagia, and heat intolerance. What percentage of cold thyroid nodules are malignant? 10 to 20%. Complications of therapy with radioactive iodine includes hypothyroidism. In thyrotoxicosis, which of the following is seen? Pretibial myxedema, glycosuria, and unilateral exophthalmos. Retrosternal tumor cause bluish discoloration of the face, edema of face, and can occur in thyroid tumors. Commonest presenting complaint of medullary carcinoma of thyroid is diarrhea. Hypothyroidism with increased TSH levels is seen in lithium carbonate therapy, post radioiodine ablation, and endemic goiter. All of the following regarding papillary carcinoma thyroid is true except bony metastasis in early age. So, what is true about papillary carcinoma of thyroid? Multicentric origin, secondaries to lymph nodes, and slow in growing. Protein-bound iodine measures secretory function of thyroid in all the following circumstances except nephrotic syndrome. So, protein-bound iodine measures secretory function of thyroid in following: hemithyroidectomy, during ampicillin therapy, and asthmatics on ephedrine. Serum calcitonin level is raised in medullary carcinoma of thyroid. Which malignancy of thyroid is caused by radiation? Papillary carcinoma. Metastasis through lymphatics is common in papillary carcinoma. Malignancy in a multinodular goiter is most often follicular carcinoma. Treatment of choice in cold nodule of thyroid is hemithyroidectomy. The only reason for operating in a case of thyroiditis is to overcome pressure on trachea or esophagus. Thyroid carcinoma is usually euthyroid. All are true about Hashimoto's thyroiditis except antithyroid nuclear antibodies. So, what is true about Hashimoto's thyroiditis? Antithyroid microsomal antibodies, anti-TSH receptor antibodies, and increased level of thyroid hormones. A 21-year-old woman has 3 cm node in the lower deep cervical chain on the left. The biopsy is interpreted as revealing normal thyroid tissue in a lymph node. The most likely diagnosis is lateral aberrant thyroid. The carcinoma of thyroid associated with hypocalcemia is medullary cancer. Hurthal cell are seen in Hashimoto's thyroiditis. All of the following are symptoms of hyperthyroidism except cold intolerance. So, the symptoms of hyperthyroidism are voracious appetite, emotional disturbance, and sleeplessness. The treatment of non-functioning thyroid nodule in a 40-year-old male should be cortisone. Toxic adenoma on scanning appears as hot nodule. A 56-year-old lady is found to have too hard nodular painless swelling in the thyroid region. Diagnosis in this case is best established by FNAC. 2 hours after subtotal thyroidectomy for thyrotoxicosis, young woman rapidly becomes agitated and complains of increasing difficulty in breathing. Her pulse rate rises and central cyanosis is noticed on examination. Her neck is found to be tensely swollen beneath the stitches. The most appropriate management in this case would be removing sutures from all layers in the ward and evacuation of the hematoma. Young female with proptosis, intolerance to heat with increased T3 and T4, Hashimoto's thyroiditis. Scabbard trachea is seen in thyroid cancer, thyroiditis, and goiter. FNAC is useful in all of the following tumor of thyroid except follicular carcinoma. So, FNAC is useful in papillary carcinoma, anaplastic carcinoma, and thyroiditis, but not in follicular carcinoma. A newborn with a goiter large enough to cause a dyspnea is best treated with tracheostomy. In retrosternal goiter, most common presenting feature is dyspnea. Cervical lymph node involvement in papillary carcinoma of thyroid, best treatment is radical neck dissection. A patient comes with single thyroid nodule. Initial investigation of choice is FNAC. Metastasis in thyroid gland come most commonly from carcinoma of breast. True about papillary carcinoma thyroid is it is encapsulated.